Welcome to the 13th episode of OTalakayan. So, hi Kim! Ano pa pala si Kim? Kim? Oh, ayan na. I can sense you coming in. Kim. Anyway, so, hello everybody. No? Magkakaroon na tayo ng mga technical difficulties. No? Kanina I tried changing my background but it failed. So, this will be my background for now. Okay, so welcome to the 13th episode. And today we'll be joined by a very special guest. No? So, siguro recap muna tayo what happened last OTalakayan. Last OTalakayan, we talked, so I was with Arden and we talked about okay, sorry. Ayan. What was I saying? Okay. So, sorry. So, last episode, we talked about providing group therapy through telehealth. No? So, today, we have a very special guest. She's right here with me already. So, let me introduce our guest. Kim! There you go.
Hi
Hello,
everyone.
kumusta ka?
Okay naman.
Beshag panic ako, what happened?
Okay na.
I'm so happy you're here. Oh, I was just talking about last session. No? So we talk about providing group therapy via telehealth. No? So ngayon, this is actually our second to the last episode on telehealth. So, sige, Kim, ano bang ating pag-uusapan ngayon?
Previously we had our episode with hand therapy, but basically it focuses on adult population. So our esteemed resource persons then talk about how it could still be delivered using telehealth, even if we would have this certain idea that it cannot really be delivered through telehealth. So for today's session, it will still be on hand therapy, but our focus would be more for the pediatric population. And that would entail different sets of consideration, preparation, and maybe certain parent coaching too, or caregiver training, because we will be talking about the pediatric population for this episode. So maybe Lee, you could introduce to our viewers our esteemed resource person.
Okay, so today, who's joining us today? It's Carla Reyes Cuerva. So Carla has been practicing for 20 years as an occupational therapist, both in the Philippines and in the United States. Carla is a certified hand therapist by the Hand Therapy Certification Commission of the US. Now she's back in the Philippines and she leads the Hand Therapy PH, which aims to promote this specialized field of practice, increase awareness and prevention, and deliver hand therapy services. So, hi, Carla. Hi. I think you're still on mute. Thanks for joining us today, Carla.
Thank you. Thank you for having me.
Hey. So, siguro simulan na natin. No?
James?
Carla, kasi in the previous episode, Caitlin Hunter and um, Kwek talk about hand therapy for adults. Ngayon naman, when you're delivering that for children, what are the primary considerations?
Okay, I'm glad you asked that because that is my first slide. Okay, so let me try to share a screen here. Well, not my first slide, my second slide. Okay, here we go. Can you see this? No problem, right? Okay. Alrighty, so again, my name is Carla. Just call me Carla, and thanks for having me. And before I start, I actually really want to give my thanks to PAOT for conducting all these webinars and series of OTalakayan. And we really needed it, especially at this time. So thank you for going above and beyond your own personal needs and even your work. And so thank you. So thank you. Secondly, thank you for including hand therapy, which is another area of practice. Not so very common in light of the bigger picture, but thank you for including that. Okay, so my first slide. To talk about pediatric hand therapy and telehealth, we have to consider the elements. So this is essentially a review, and this has been touched on from the very first Talakayan all the way to present. And I see the relationship and interactions of all of this as little bubbles. So I'm very visual. So I try to draw it out, and this is the screen and the page you see. So the first element is you, the therapist, right? So you consider yourself, all the abilities you bring in, but also the context and environment that you are in. And then you have the patient, and since we're talking about a child, laging may bit-bit na caregiver yan. Si mommy, si daddy, si lolo, si lola, o buong bayan, okay? One child comes with a whole lot, and oftentimes it's really therapy for the family. So you have those two elements, and telehealth is basically the platform by which we bring all of these things together. And we already know the different forms of telehealth, and the way I see it is it's telecommunications and informatics. So if it's connected to the wall, or if a device needs battery or electricity, yeah, it's considered telehealth, and you're trying to merge it just to simplify all the forms. And so there are very many different kinds, even just regular telephone, okay? So yung mga namamatayan ng internet, there are ways of going past that. It doesn't have to be super high-tech, although virtual reality is considered part of telehealth, according to AOTA. So now we look at the relationship of these three elements. And when they all come together, you have that in the center, which is hand therapy. Now, the ideal that we may see is that, oh, super compliant family, and then you, the therapist, you've already transferred and transitioned all your hands-on care virtually. And we may think that that is enough. And if you've been able to achieve that, great. But the biggest fourth element in here to consider is the pandemic situation. And it's been overtalked, but it is the situation we are in. So while it is already challenging to deliver telehealth of pediatrics, dagdagan pa ng pandemic. And where this comes into play is that these are bubbles, these are circles. It changes on a daily basis. It is fluid. So even if maybe you have a family who was doing really well in the beginning and then nawala, or you yourself as a therapist, you know, you decide, I still don't want to do telehealth, or situations change. So that changes everything. And alam mo na, therapists like control. We need a sense of control. It's hard enough in a clinic setting, then you put the virtual part, you put the technology, and then you put the pandemic, and suddenly it becomes a very big challenge. And I think that is one of the most important things to consider in light of this, okay? The most important thing at the end of the day, the beginning and the end of the day when I see my patients, the most important thing to remember is that you're developing, maintaining, sustaining relationships and connections. And when I feel myself admittedly flustered on how to do a hands-on approach, a hand therapist. You know, I need to touch your hands. Bawal yung hands. My distancing pa. So how am I supposed to do that, right? So relationships and connections, and that has been very much discussed. But what has not been discussed as often, and probably will be the future topic of Talakayan, I think, is that you have to nurture yourself first. Okay, yes, it's yourself first, not yes, the patients, but you first. It's like being on an airplane, and you know how when they tell you about emergency situation, what do they tell a parent? Put the oxygen on yourself first before you assist the child. And I am bringing this up now as a very important consideration because you have to secure yourself first. You have to be, as a therapist, ready to really dive into all these bubbles, floating bubbles. And only then, I think, once you secure yourself, only then can you really nourish the relationship and connection with your patient. Because once you get through your patient, it's like I think it's like a portal. This little tiny hole I see in my camera, that's like a portal. And you suddenly enter their homes, their lives, and everything else. So it's hard to give. It's very challenging to give support when you yourself are so needing it. So that is a very important consideration that I do want to bring up. So hats off to you therapists who are here and listening in and really trying to do the best for you know, with the situation and everybody else. Okay, do you have questions on that?
Okay, thank you, Carla. You know, I realized, I like what you said about establishing that relationship. That's kind of easier if you'd had your client, for example, face-to-face previously, and you just transfer to telehealth. But I could just imagine how it is for therapists who would need to accommodate new clients. That's a whole lot different thing. No?
Yes, it's challenging. I'm not going to pretend to say it's easy. Fake news, Yan. Fake news. It is challenging. Okay. Alrighty, here we go. I'm going to move on. I think my first slide is like my longest speech. So that's like my long intro. Alrighty. Here we go. To talk about pediatric hand therapy, I need to touch on hand therapy, what it is. So hand therapy really is a specialization. It was born out of need with increasing complexities of the surgeries, of the skills of the surgeons, and even of the hand itself. So the need came about that, okay, we need therapists who can equally grasp the complexity of all of that. So it is an art and a science of upper limb rehabilitation. It is a merging of OT and PT. And what I mean by that is you have your therapeutic activities, you have your ADL, you have activity analysis, you have all the roles as a therapist, and then you start integrating knowledge on anatomy, joint function, manual therapy, exercises. So it starts to come together. So yes, in other countries, there are hand therapists who are PTs and OTs, and some very developed hospitals and like some of the few that I'd worked at, hand therapy is a department on its own. You have OT, you have speech, you have PT, and you have hand therapy. It is a fourth department. Now, when we talk about pediatrics, so like you said, we already had a Talakayan covering the adult practice. It is quite different for pediatrics. And here you see on the screen, these are the most common diagnoses that we see with pediatric hand therapy. Okay, and all of these I took from the chapters of a new book released this year, which is Pediatric Hand Therapy. You have congenital hand disorders. So the first sample of that is a picture. Someone tell me what is different with this hand on the picture. Len, ikaw host ko eh.
Hi.
You can do it.
What's different with that hand on the picture? Oh, parang merong extra thumb. Parang ganun.
Yep, that's right.
O
So this is an example of a congenital hand disorder. That's right. Bingo, ding, 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 ding. Okay, it's thumb duplication, polydactyly. There is a very long, complicated diagnosis, but yes, this is an example of a very non-typical developing hand. Now you have neurological, joints, sports, and trauma. Now the ones with the stars are the two most common diagnoses I have seen with my patients during this time. Because, diba, even if the kids are home, they get restless, nababalian, huhulog, kung ano-ano nang ginagawa. Kasi they are meant to move and we have to keep them indoors. So the next few slides, well, most of my discussion today would be on actual, real patients that I am seeing on telehealth right now. So we will be talking about trauma and some neuromuscular ones. Now, so that's hand therapy. To talk about pediatrics is to talk about their number one occupation, play, right? So no matter whether it's sensory integration or different subspecialties, the minute you say pediatrics, you are associating play with it. And so the first thing I want to say about pediatric hand therapy, it looks like a regular, typical therapy session where naglalaro kayo, but there are embedded goals with why you do what you do and how you're playing with the child. So it is no different in appearance, okay? Play is what integrates everything because the child uses their hands to navigate and explore the world. So the play integrates purposeful hand skills to pinch, grasp, and manipulation. To use play is the best way to motivate the kids and to engage with the family, okay? And it's a lot of explaining to the caregivers and the parents bakit yan yung hahanapin ng laruan or bakit ano ba yung goal natin is no different with hand therapy. So next slide. This is a busy slide. So I'm going to give you a few seconds. Screenshot this slide. I'm not going to read it, but I do want to highlight something. So just quickly glance on it. Screenshot. It's going to help you. This is where, you know, you need the uncomfortable pause. Parang may connection ba? She's still talking. Are you still there? Okay. This chart, I've collated this after a lot of review on science journals online because, you know, I kind of had to prepare, right? And this is coming from Jill Peck-Murray's article on the American Journal of Hand Therapy. So here we go. This is Piaget, Takata, all of those frames of references and really words that we only heard in OT 101. So this is the compilation of this. And why I am focusing on this as a topic of play is that if you look at the last column, the pink teach column, look at all the verbs. These are action words. These are the words that guide me in forming my goals. What do I want to do with this child? What am I wanting to achieve? These are goals related to their developmental stage. It is always purposeful. So I love this slide because as I'm trying maybe to think of how creative I can be, I look at these. And we already know that the skills build upon each other. So with a baby who's just mouthing their hands all the way to gaming, you know, you're there on Animal Crossing or whatever just they're playing, it builds upon that. So yeah, take that screenshot because it's a really nice guide on play skills. You have any questions so far? All good? Thomas, one more technical slide and then kwentuhan na tayo. Patience na. I just had to put this out because, you know, it's necessary. So I had a fangirl moment, not in K-drama, okay? It is with a therapist, very notable in this field of pediatrics and hand therapy. That's like two specializations. Jill Peck-Murray, and my fangirl moment is because she is the mentor of my mentor at Children's Hospital when I used to work there. And when I was looking, I wanted to access her journal article and I was stuck because I just, you know, people closed their libraries and stuff and hospitals had been closed. So my mentor connected us together, and my fangirl moment is that I'm like, wow, I'm speaking to the author of so many books and so many presentations on pediatric hand therapy. And through our email, she told me this, Carla, just keep it simple. Okay, hand therapy for pediatric clients, everyday activities, play, everyday activities and play. And I can't overemphasize that. I know it sounds so simple, but I am really, as she had advised me, reminding myself and everyone that it doesn't have to be complicated. Technology is complicated enough. In my selection, I always think in my selection of activities, I don't need to complicate it even more. So as we look into the client's home, I really try to get clues on how do I do this with everyday objects, especially because we have a wide range of, we have to survey a very wide range of clients. And wala na tayong high-tech toys ng clinic. We miss our favorite toys. And when we look at the toy, we always think, how am I going to do this? Not everyone is also tech savvy to translate this digitally. And I know we had a great talakayan on that, and I watched, and it was just quite amazing and inspiring also. But sometimes bringing it down to fork, spoon, cotton ball, scissors, paper, pencil, sometimes that's all we need. And wanted to share that slide with you. Do you have questions? I'm going to stop right here.
Oh.
Stop share.
Oh, Kim?
Okay, so that was a very interesting, I can say, reorientation, because most of the time we are considering hand therapy as very technical, but it was good that it was really merged again to the primary occupation of a child, which is to play. And as hand therapists, that area or that perspective should not be removed from our day-to-day processes or from our day-to-day provision of therapy. Then you mentioned something about the different play levels, the verbs that you are using when you are doing your goal setting. So I think that would really be of great help to our Filipino therapists who are venturing to this field of practice. So maybe our next question would be, we might want to zoom in a very important stakeholder in hand therapy, and that would be the parents, because we're talking about children right now. So in telehealth, particularly if we are delivering hand therapy, what would be the main role of the caregiver or the parent?
Okay, great question. I have a slide for that. Hold on, let me try to share this. Okay. That is a fabulous question, because really, like I said earlier, when we look at pediatrics, kaakayan yung parent all the time. And the value is really in caregiver and parent training. So this is my slide one. My slides, these are all current active patients, and they have given me full waiver to discuss their cases. Medyo nagmakaawa, just a little bit. No. Just because I figured it's the most real approach to talk about pediatric hand therapy by actually using my everyday patients right now. So in answer to your question, caregiver and family training, it is highly, highly important to involve them. It is impossible not to, even if we are dealing with teenagers. More so in early intervention and in the earlier years, 0 to 2 to 4, and that is exactly my first picture. This is Tiago. At 10 month old, his arms were still here. No active play, no active reaching, and disclaimer, I'm his ninang, okay? So ninang can only spoil. That's my role. So I know I have at least 2 therapists in class right now who sees this child. So I am speaking as a ninang. Okay. And the biggest challenge was Tiago was born with a congenital heart issue, and he had past tense, had a twin. The twin passed away. Oh. So Tiago was really nurtured and carried all the time, because the doctors told them, kung mapagod, baka bigla na lang, tigil na lang yung puso. So that was the back mentality of that. And as the ninang, I completely understand. By the way, side note, that's one of the things, the emotional areas. Once you're in the home, this is my portal, right? Once you're in the home, you start to feel those. And as an OT, we're trained physical and psychological, the whole person, that has to come into consideration. So the most important thing that we did here was, because both parents work with the therapist, really focused on caregiver training. And in the earlier year, the first year, I had Yaya, and we would teach them how to play. I would look at the toys in the room, and that's where I would get my choices of activities. So I go, Yaya, yung sa inyong phone dyan, pakikuha. Okay, tapos I would really just, okay, put that in here. And with exploratory play, it's banging on things, mouthing things, holding things, and just really, it's a sensory experience for them. And it was absolutely necessary. Okay? And even to this day, with my other kids, I have the caregivers. I try to make it a point that after I see the kid, oh, by the way, I only do 30-minute video conference. This is my preference with a child. And after that, I recap with the parents. For one thing, at this age, the kids will not sit for you. Swerte na lang ako if they even come to the camera for me. It is not an expectation for me, and I know this has been discussed in OTalakayan. So caregiver training, asynchronous, non-live ways of delivering pictures, send me videos, example on how to facilitate. That's all part of early intervention. Okay. He's older. This little kiddo, his mom wants to homeschool. So the mom had asked, okay, Carla, can you take a look? Is he lagging with his fine motor skills? How do I improve his summer, his everyday? Because we are now teaching from home. And here we are. Kid Shane is developing age appropriately. I actually told the parents, please don't force a pen and crayons in their hand if they're not ready. If they're not ready, please don't focus on toys, not on writing, and focus on just squeezing, pinching, those verbs I had said. And same thing with Shane, it was all 100% parent interaction through texting, Viber, and an email. My choice of delivery on how to speak with a patient's family is dependent on what they have with technology and what they can access. So I always still write out my home program. I save it for myself because I need to remember, and I am obligated to keep notes. But if Yaya will say, ate, Viber lang po meron ako, then I will take that and transfer it to Viber. If mom wants email, I will send it to email. I keep things short and simple, no more than 3 instructions. I explain what you're doing and why you're doing it. It is crucial in documentation for any population. We have to write why. After a while, kasi diba, like in the notebook, the running notes, parang nakakatabad na lang, paulit-ulit-ulit. But actually, it is in your notes where you shine most with the science in your therapy. What do I mean by that? I'll show you in the next slide. Okay, here we are. With this little kiddo, the problem of the teacher and the doctor is he is lagging in pinch and grip strength. Parents also are busy, so I only see him on live conference once every so often. And my homework for him were 3 things for the week. You bake with mama, play Lego, and write your name. I do not force the writing, even if that's a reason for referral. Bake with mama every day, play with Lego. And the mom who works is more than happy not to feel bombarded with so much to do because, you know, parents who are working are also now schooling their children. So facilitating the bonding. And where I was going with this, these were the only 3 things I wrote. But I didn't just write baking, Lego, and whatnot. I said, okay, we need to do this skill, this motion to improve the sensory awareness of the hand. We need to develop the fine pincer grip. So this is a good toy, the Lego. I put my rationale right in there. And that's what reflects the science of your assessment, your activity analysis. So as difficult it is at the end of the day to write your notes and to really relay the value of the play that you do. Kasi on a caregiver, hala, naglalaro lang sila, parang, am I supposed to pay for this, right? No, that's really, no, it's true. Sabihin na, diba?
Of course.
Because on an outsider, ay, naglalaro lang sila. To me, that's a compliment. Yes, we're having fun, we're playing. But in my notes, when I write my purpose. So that's, I hope I more answered that question with well, kind of touching in on documentation. Whoa, backing up.
Okay. Carla, I like the idea that I like what you mentioned about yung kaya sa baking kasi it tells us now that it's still important to also consider the routines of the caregivers, for example. But parang I always tell the interns I supervised before that when we provide home programs, we try to incorporate it also with their daily routine na hindi magiging another burden yung pag-i-implement ng home
That's
program at home.
right.
Diba? Especially now it's pandemic, no? So parang we try to avoid additional burden. Pero it's good, no? Parang having the child help in chores. That's really cool. No? Very
Yes, you hit the
practical.
nail on the head. That's exactly my driving point.
Mhm.
That it doesn't have to be complicated. It is an ADL skill. You are incorporating your program into the everyday activities with everyday tools, and you're trying not to burden the family with way more homework. I actually have a parent who said, Carla, I can't do homework. I really can't. I have 3 kids. I'm working. I'm cooking. Hindi ko kaya mag-homework. So yung request niya sa akin, no homework, please. And I respect that. I mean, I document it for my own notes, but she doesn't want to be bombarded with do this, because she sees it as a task list. So you're absolutely right, Len, that in these situations where you are sensitive to the needs of the family, that is a consideration. Embed everything in ADLs. Isn't that the core of our profession anyway, right?
Definitely.
Yeah.
Okay. Thanks for sharing about that.
Yeah.
So, well, another question that we have is, so how is progress monitored? Now, some members of the audience may be asking that. How do you do your documentation, for example?
Okay.
Hand therapy.
I'm reading the chat question. I'm holding our helmet. What is the best response for this? Okay, I think I can answer that with those 2 questions on my next slide. So again, these are my current active patients. Okay, with permission po. Boom, there we are. This is a legit hardcore hand therapy, hand surgery, complicated case. I'm going to talk about this and answer your questions on evaluation, documentation, and feedback kung okay ba yung gawa nila.
Yeah.
Okay. This is Lucas. He is 11. The injury was last year. So I had been doing telehealth for a while, and this one was a case where he was cutting vegetables, tapos nasugatan siya ng knife. And at that point, syempre, small cut, very small cut, they brought him to the doctor, pinahian, tapos, okay, uwi na kayo medicine. But later on, especially because it's the pinky finger, the pinky is kind of easy to, because this is our function, the most that we use for function, it wasn't very obvious, I think, that the pinky finger didn't get back full motion. So the first picture on the left, that is his flexion. Okay, that is his flexion. And the question, how do you do your evaluations? This is 100% telehealth kid. I didn't know this child before. I actually told the mom who was there and present, I said, Mommy, do you have a ruler? So I really told her, okay, make a fist. Make a fist, put the ruler there, tansya. That's what it is. And always, Mom, and measuring, what I'm measuring is the gap of closure. That was my beginning. So to see whether with my therapy intervention, will I be able to improve it? Okay. Secondly, I take a screenshot. And yes, I take my screenshot with permission on your waivers, screenshot, and I put it right there on my evaluation. I use that to track progress later on. Second picture. So the injury was in August. I see him in November. With my picture and with my measurements, I see na walang progress. Wala. No matter what, the tendon wasn't, the word is firing. The tendon wasn't activating. Hindi gumagalaw. So finally, I told the mom, you really need to pursue a hand surgeon, and you do the, and true enough, the tip, the tendon at the tip of the finger, 2 points, if you know what that is. I'd give you chocolate, but I don't have chocolate. FDP, flexor digitorum profundus was completely transected. So I tell the mommy the tendon was cut, not all those big words, right? And so the doctor couldn't salvage it. He couldn't repair it. It was too late. So of course, guilty then yung mom. Yeah, too late, too late. So they had to repair it. The technical terminology, they had a tenolysis and they had to take the one arm of the SDS to transfer it to the STP and to be able to have, kasi naka-stick out lang ganyan siya. They try to create a natural functional bend so it doesn't look like nakaganyan lang siya.
Yeah.
So the third picture is him post-surgery, and the first thing you notice is swelling. How do I measure swelling? Picture. That's all I can do. So, you know, it's just being real. I cannot, if they have a tape measure, okay, but really, since we have technology, I'm gonna use technology. When I see this, I see size, the difference in size. I note the digital creases are decreased. What does that mean? Kulubot yung normal finger, and the swelling on the other, it's shiny, it's smoother because of the swelling, the post-operative swelling. So that is how I measure that.
It's good because you have a comparison, no? I mean, two hands.
Yeah, actually, fast forward to where we are present day when he would say, I don't think my finger is getting any better. I said, okay, Lucas, let me show you the very first time we took this picture. And he's like, oh, it's better. Because that's his every day and it can't get fast, you know, it can't heal fast enough. Then he was like, oh, okay pala tong digital screenshots, parang it's helping me track progress. It's the same thing I tell the parents, you know, and I show, look at the progress from month 1 to month 2. Oops, the other way. Okay, so this is a screenshot of our sessions. Ganyan pala yung itsura ko pag intense.
You look so serious.
Serious yan.
Serious.
So that's my apparently intense face. But I look at what the child has in his room. And if I want to go like this, how boring is this? With adult population, I can tell them, oh, do tendon gliding and do all of this fancy dance. That is very, very boring. Pediatric hand therapy is making things fun, choosing novel activities, meaningful, purposeful. And you know what? I do tell him, I say, Lucas, go find me Lego. And he's a Lego fan. So, okay, go get R2-D2 and squeeze him and try to get your finger to wrap around his body. That is my language with him. And of course, in my notes, mommy, we're doing this in order to do this and that, right? So putting all the technical notes there. In the beginning, when mom would ask me, Carla, am I doing this right? Particularly with the massage, you know what? I would have a session and have them both there. And I say, show me how you're doing your, what do you call it, retrograde massage to bring down the swelling. So demo. So when in answer to the question in the chat box, how do you do it? I have them both there. I send pictures, I send video on Viber, and I have them live. And every time I see them, I reinforce it. So when I say, okay, swelling, and it's so hard for a very touch-based profession to use your full vocabulary in expressing how to do it. I say, okay, slowly massage the finger. If you pretend, Lucas, like, you know, when your toothpaste is running out and you have to gently ease and squeeze the end of your toothpaste to the very end, that is how much force you're doing. You're just very gentle and you're envisioning that you're just slowly moving it from top to bottom. So yes, I use a toothpaste tube to explain pressure. So I have the mom right there. And I bring my kids, I have two grown kids already. I use them as my props, whether they like it or not, okay? So I pull my child in, I have them here, there's like 4 hands on the screen, and we're there discussing and really even showing the exercises. So I hope I answered that chat box. So back to Lucas, here we are, that is your tendon gliding. That's the second, top right picture, that's his active range of motion as of yesterday. And because he cut his hand on a knife, it was very important to me that this child didn't develop trauma. So I did do ADLs and table knife with therapy. That is therapy.
Okay.
And we do it, it's working on pinch and pressure. Now he can hold a table knife, he can cut, he's not developing averse reactions towards that, and because really I have seen some kids who had traumatizing experiences with a kitchen knife, and hopefully in a couple of weeks I will have him hold a real kitchen knife and have the mom bring me to their kitchen. So that's the story of Lucas, and this was us yesterday. I didn't know how to. We used FaceTime yesterday. Typically, I use Zoom in case you're gonna ask me. I also use whatever is available to the client. If it's Messenger, I don't want it hard for them. I don't tell them, go download this. Ano po yung may meron po sa bahay? Si Yaya ba or si Mommy? Different technology yan eh. And then kung naputol ako, call by landline. I really do. So use the full spectrum of telehealth and don't be so nervous. Although I am pretty nervous every session because it takes so long to prepare for them, right? So this is us. He was teaching me this age group, loves technology, teaching me how to do that. And I learned something new yesterday. There. Did I answer your question?
Yes. Actually, I have a follow-up there. Kasi you said, diba, parang use what the client has. You know, therapy, for example, is one very useful modality that we have for hand. It's moldable. It offers some degree of resistance. Have you encountered a client without a therapy at home, and you have to have a makeshift? You have to make, makeshift therapeutic material. How to do it?
This is my one patient who had therapy. Okay. Everyone else has no therapy. Do you have therapy in your house?
I don't.
Mine melted. I don't have it because it makes a mess. My kids play with it. So the question to that, instead of thinking of the toy and the tool you are missing, think of what is your goal. Ultimately, what do you want to achieve? Why do I need therapy? Remove that. We do not have a toy cabinet in our accessible anymore. This is the challenge of telehealth pediatrics, which is why we're having this webinar. But if you think the child needs therapy, why does he need it, right? And instead of asking mom, go buy therapy, that's just an added burden. I would think, okay, if I want, like for Lucas to develop grit and strength, okay, maybe is there a recipe I can give for Play-Doh? Does he like gardening? May access pa sa lupa, and really getting into that sensory detail. I have one who lives near Lucas lives near the beach. And I said, okay, your homework for this weekend, only one alone. Go outside and dig a big hole and play and build sandcastles. That is my kind of homework for them because I keep on reminding myself it's play. So don't think about what you're lacking. Think about how you can substitute that based on the play level of your child and your therapy goals. Yeah.
Thank you.
But if not, go garden. There's like sa labas.
Yeah. I think Kim's gonna ask something. We have a question from the audience. Kim?
Yes. There's this one question. The main concern of the parents I work with is, am I doing this right? Am I holding or handling my child right? What is the best response for this type of questions?
Well, I actually say, well, let me see. I can't say yes if I don't see it. So I say, let me see. Padala po kayo ng picture or video sa akin. May time ba ho ba kayo mag-live para makita ko po? And then I try to access them in their read. So yes, and then I can only judge something if I see it with myself. And that's when I coach them. And I know we've had a session on coaching, and this is where it comes in. Did I answer that? Yeah. Okay, I have one more case.
Okay.
Last case. Excited eh. Okay, here we go. Okay, here we are. This is my last therapy case. This is Ava. She is 12. So I essentially have children who've covered all the developmental stages of play. Okay. And Ava, picture on the left, what is different with that finger is that she broke it. It is rotated. She broke it. She's a gymnast. This is a sport very near and dear to my heart. She fell off the beam and she broke her finger. Second picture, that when she went to the doctor, they had to put wires, K-wires. And 2 weeks in that. Now, the last picture, that is how her hand looks. So, nagpanic siya. when she saw her hand. Because naman, what kid is not gonna panic when you see nails and screws coming out of it? So right out of post-operative, I told the mom, okay, and she did contact me early, which is really great because it's such a joy to come in right before surgery. It's early active motion is just phenomenal, and you'll see it with this case. So I told mom, okay, mom, this is what you're gonna expect. You might wanna tell Ava this is what her hand may possibly look like, and so that's the warning of that. And Ava seems to be okay with it. This is our first therapy session, and on the left, she still has her pins in it. And the biggest fear of anyone is, am I supposed to move this? I don't want to move this. She had already been in a cast for about 2.5 weeks prior. So our first session is early active motion. And what that basically means is moving the fingers that are not hurt, move what you can, respect your pain, and start working on bringing down the swelling with my toothpaste tube comparison. When the pins were removed, the issue now was on scarring. So if you're in hand therapy, you know scarring is a very big issue because in the hand, a scar can severely limit motion. I mean, if you pretend that you have a scar here and you pin it down and heat up, it will really make it very difficult for you to make a fist. So the homework, okay, mommy, get a bin with rice. Plastic bag po ng bigas. And they're like, what kind of therapy is this, right? And that's when I start introducing desensitization and helping the hand be exposed to regular, the sensory components, actively grasping, and it's just very calming to work with that. And bigas is readily available. But on my notes, I will explain that rice activity for homework, this will help bring down the sensitivity. I really, really explain it, or else they're like, what kind of therapy is this? Playing with food. So that's where I present that. Here we are, last slide on her. This is her injury was in January 2, after New Year. And after 2 months, because she had early active motion, she was like, wow, super. I like working with athletes because they really just, they know it, they understand it, and they just go for it. She sent me a video. It's not a video because I was afraid of our bandwidth today, but she was showing off and she took a video and sent me with her doing her acrobatics. And while I'm looking at the acrobatics, naisip ko, sinong may balance beam sa bahay nila? Here I'm worried about therapy. This girl has a balance beam in her house because she's a competitive gymnast. And here she is, her first meet. They're already, wala nang COVID. They've more relaxed. And there she is, like there's no trouble at all. And that is the value. Yeah. And we're talking about this is a few sessions of therapy and just a lot of reinforcement and coaching of the parents. Nice. Oh, there's my last slide.
Oh.
Yeah. My favorite quote. And that's what I tell myself every day when I wake up when I'm feeling a little flustered. And, in this situation, we just do our best. Every day is different. We do our best. We have an amazing professional that can reach out and really holistically look at a client. And I give joy in that. And it's, like a last song syndrome, if there's anything you remember of what I said today, other than play and keep it simple, is that, we have an amazing ability to bring light into homes. And I really think about that and I reflect on that every time I turn on my Zoom, like now. So that's my end note for you all. And
thank you so much, Carla. That was a lot of fun listening to your presentation. Thank you. And thank you for sharing your experiences with your clients.
Thanks.
Yes,
thanks
you
very much.
Carla. I think there are no more questions. So maybe I could just give probably my realization when it comes to your talk. Yes, it may be simple play, doing these basic activities, but it was good that you were able to make us believe and make us affirm again that even if they would appear to be simple, these are the core of our profession. And you just need to continuously justify, give rational why we are doing things. And I don't think this is just limited to hand therapy. It could be on any other practice area. And most of the concern of Filipino OTs would have something to do with limited resources, limited materials, and you gave us the assurance that even if there might be these limitations, we could still proceed with our therapy sessions. And given the cases that you have presented, they really made certain progress. It really the goals, the outcomes that you have set were also attained given the restrictions, limitations that we have, even if we have this pandemic. So thank you for that presentation.
Thank you for that. Thank you. That's exactly the message I had hoped to deliver through all that. That it doesn't, you know, I'm an OT. You're an OT. We are OTs first. The rest is specializations that are preferences and how we practice or skill sets. But at the end of the day, I always think, oh, how am I going to keep this simple if this were my child? How will I make this easier for myself? And I hope you would think the same way too. I'm glad that you got that message from all of us.
Yes, thank you so much. So we'd also like to thank everybody who joined this OTalakayan. For those who missed this, it's gonna be available in our YouTube channel until the end of the month. Okay, so at the end of every episode, we plug the next episode. So our next episode, episode 14, that's gonna be the last for Telehealth. It's going to be on June 22 on Monday at 4:30 in the afternoon. We'll have Dr. Constantine Uchua. He's a medical doctor and a psychiatrist and an occupational therapist as well. He'll be talking about burnout, resilience, and mental health of OTs utilizing telehealth during the pandemic. All right. So thank you again, Carla and Kim, for joining us today. And thank you to the 27 people who participated in this webinar. So see you all on our next Talakayan. Goodbye.
Goodbye.
Thank you.